everybody. Thank you for attending to the Biolab book presentation. My name is Vanessa Rouault, and I am the head of partnership and business development at Biolab book. So to introduce it briefly, Biolab book is a breakthrough patented technology which make us able to see the early biological drift inside the reference value. So our technology is available in a software which is developed internally. Our software is CE marked, and it's an in vitro diagnostic medical device. Our work was recently published in Clinica Chimica Acta and in Nature Scientific Reports. And our technology was also awarded many times. For example, at the GISE event in Belgium in 2022, we received the Innovation Award. And at the Biology Day in France, we received the Most Innovative Startup Award. So now I want to talk about diagnostic odyssey. Is it possible to diagnose many years earlier? So I wanted to present you this example of lab analysis for a patient who was diagnosed in 2024 with an essential thrombocythemia. So if you look at this result, so for the example, it's potassium level monitoring, but for this patient, many other biological parameters were measured. So if you look at the result, you can see that the results remain inside the reference value, which are the dark line at the top and at the bottom, until 2018. And from 2018, the results start to fluctuate around the upper limit and lead to a diagnosis only in 2024 with a very higher value. So now, if you look inside the reference value, you can see other zone. You can see a green zone, which represents the optimal biological value for this patient regarding its personalized characteristic. And you can also see orange and red zone, which represents the early biological drift zone. And what we see with our technology, if it's when the results start to drift, they go after many months or years outside the reference value, and this leads to the diagnostic. But if the doctor could have our software before the diagnosis, maybe he would have made other choice to diagnose earlier. So why today a challenge exists in interpreting lab results? It's because reference value are made on reference population which are heterogeneous. There is men, there is women, there is younger people, older people, and many different people. What we do at Biolab book, we have recalculated the reference population in a personalized and customized way, meaning we can attribute the lab result for a specific individual regarding its specific characteristic to its specific personalized reference population. And so we can run the result inside the reference value in two other zones, the biological optimum zone corresponding to optimum biological value for which the patient feels very well, and the drift zone, which is a zone where the first clinical sign appears. And for this patient, the optimal zone is at the middle. But if you look the same result for another patient, it can be more upper, and for another patient, it can be more lower. So we optimize reference population for more than 120 routine biological parameters. And with our technology, we also take into account the linked biological parameter, and so we can estimate more than 150 biological parameters which are not measured in the blood test. So thanks to our whole reference population optimized, we can see early biological drift in many therapeutic areas which are listed there. And especially for clinical trial, we can also monitor dozens of safety biomarkers, and we can also monitor the outcome, the biological outcome of clinical trial in all the therapeutic areas listed there. So our solution is currently used by partners in France and in Belgium. For example, in France, we are in partnership with the Innovating group, which is a group of medical laboratory which cover 20% of the French population. In France, we are also in partnership with the URPS, which is a group of general practitioners and specialists. We have also partnership with hospitals in France and in Belgium, and with researchers and health software providers. We have also some partnership under discussion with Germany and Canada. And today, we will be happy to find our first partner in UK. So we are looking for healthcare partner. It can be a general practitioner, specialist, biologist, or hospitals. And we are also looking for partner in clinical research. It can be medical investigators, sponsors, or CROs. And now I want to present you a demonstration of our software. So can you play the video, please?
Let's explore together how to effectively use the BioLogbook healthcare software. Once logged in, you access the homepage where you can view the biological results you have received for your patients, displayed in a format similar to a classic email inbox. Your patient's results are sorted by examination date. Select the one you wish to review. The innovation lies in how your patient's results are displayed. While a biological result is typically presented with a simple reference range, the deviation summary table allows you to directly visualize the degree of deviation in the analyzed parameters. At biological optimum, drifts, important drifts, or outside the reference values used by laboratories. I notice that this patient has a drift in gamma GT levels. Let's investigate further by clicking on this parameter. You can access the graph of the patient's historical results, in this case, the gamma GT levels. The graph includes value ranges corresponding to the drifts intervals calculated by BioLogbook. The personalized optimum for this patient is shown in green, indicating their optimal gamma GT value. The drifts levels are represented in yellow and red. Horizontal dashed lines denote the reference values. The color of the points also indicates their level of drift. You can access the exact value and the examination date for a specific point by clicking on it. After reviewing your patient's results, click on Forecasts to complete your analysis. The software provides probabilistic estimates for analyses that have not yet been performed, giving you even more information from a single biological report. What's new is that BioLogbook Healthcare offers a probabilistic estimation of a parameter, here, calcium, at the time of the last examination. The estimation is presented with its confidence interval and the probabilities of the value being outside the reference intervals or drifting. This will guide the prescribing doctor in further investigations to establish a diagnosis through additional biological analyses. In clinical research, it provides a series of additional exploratory biological estimations.
Thank you. Okay, so our BioLogbook software, our BioLogbook healthcare software is available as SaaS or on-premise. We also develop a software for patients to help them to better understand their lab results, and we also provide services using our technology to analyze retrospectively clinical data or real-world data. So thank you for your attention. I will be happy now to answer to your question. And if you want to discuss with me, I am at the Business France booth, the B6 booth, and I will be happy to discuss with you about your project.
Does anyone have any questions they would like to ask? I can ask a question while we're waiting for people to ask a question. Thank you for showing this. Again, as a GP, having worked in the past, having to analyze these trends for patients has been very, very complicated. Can you maybe say a little bit more about the data sets that were used to train this, if that's okay?
Yes, sure. So to train our algorithm, we had several data sets. So we had first a data set from hospital in Belgium, and then a data set from medical laboratory in France. So in total, our data set to train our algorithm contained 37 millions of data of 2 million of patients during around 10 years. And then to establish reference population, we follow the same guidelines as the one which exists for the reference values we all know. So we follow the same with the same restriction to be sure that our reference population are in accordance with the guidelines.
And so with your aim to maybe come across the UK or like explore what's happening in the UK, when you take your model and you move to a different area, what steps do you take to retrain or fine-tune this model?
Yes, it's something we test when we train our software for Belgium and for France, and also for hospital patients and from laboratory data. So we have our algorithm which are trained to establish reference population, and then we need another data set from the typology of new patients. So for example, for UK, we need UK data to validate our algorithm on this new population and to be sure that our reference population, which are optimized and customized, correspond exactly to the population we want to monitor.
Fantastic. So if there's anyone here that knows how to help Vanessa in terms of that side of things or connections on the fine-tuning and the validation, I'm sure she'll be happy to hear, as well as business too. Any other questions at all? Other with that, I just want to say thank you very much again. We're going to take a tiny pause and then going to go into another workshop. So thank you.
Thank you.